Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, a lot going on in the state capitol. We'll talk about gaming expansion, alcohol, the expansion of the sale of alcohol. What about the state budget and the recently passed pension reform? We'll talk to Dave Taylor and to Gene Barr about that. But first, let's get into whatever nationally we're talking about. How about Medicaid expansion as part of the health care reform? We'll get to that and many other subjects in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, welcome back to the program. Well, Russ McDade joins me. He's the president and CEO of the Pennsylvania Healthcare Association. He comes in from time to time. We look at a lot of issues, particularly affecting senior citizens in this state, and Russ is the president and CEO of an organization that represents what do you tell us?
The Pennsylvania Healthcare Association, representing seniors and those who provide their care.
There you go, in a sentence, much better than I could have done. All right, one of the problems that the health care reform bill that passed the Senate, that's in this United States Senate right now, passed the House, is in the Senate, has to do with Medicaid and the funding of Medicaid, who's eligible in simple terms. And by the way, it looks like the Senate is going to reinstore some of the funding and some of the mechanisms to get money into the hands of folks who need it. What's your big concern about this? I know that you are, and you have positions on it.
Yeah, Terry, we were just in Washington, D.C. last week, in fact, speaking to both Senators Toomey and Casey about the issue. And our concerns are really, as the population that we care for, as you know, our aging population's growing. The vast majority of them rely on Medicaid, not Medicare, and that's something that most people don't know. We've talked about that before.
Yep.
Medicaid to provide their care once they exhaust their resources and their money runs out. And each of the proposals, the House proposal, what we all believe will come out of the Senate, falls short of the growth in the Medicaid program that we need to see to meet the needs of our seniors and people with disabilities moving forward.
Yeah, well, as we look at this, it particularly, given what you do, what your members do, how many folks are in nursing homes, would you estimate?
Well, there are 82,000 on a daily basis here in Pennsylvania. That's all.
That's all. Just 82,000 people.
Yeah.
Size of a city.
Well, and about 52,000 of them are paid for by Medicaid.
That's what.
That's the piece.
Yeah, that's where I was heading to. So without that Medicaid money, those people either you all have to do what you have to do to try to help them, or they lose the care. And let's be honest, at some point in life, whether you want to go voluntarily into a facility like yours, or the folks who care for you just simply can't do it because they have employment of their own, this is potentially a big problem. Yeah,
very few people enter a nursing facility voluntarily. It's not like going to a hotel for the weekend. However, we provide a home-like setting and a high quality of care when someone needs to be there. It's usually a life event. It's a health event. It's a fall, it's an injury, or a change where you just can't be cared for in home. Your sons and daughters, grandsons and granddaughters, and you work together and say, we just can't do it anymore.
And as I like to point out, I don't think you can find a family in the state that in one way or another has not been affected by this. I mean, it's that important. And so in terms of the Pennsylvania budget that's being debated as we speak, what aspect of the Medicaid funding matters for the state? And we can point out that there's a federal-state component, right?
That's right. It's about 50-50 match. So the state puts up $1, the federal government puts up $1. That's why there's a conversation in Congress. Right now, with the Medicaid funding as it is, nursing facilities are still losing over $25 a day for every Medicaid patient they care for. That's why we're so concerned those cuts would even be more drastic and make it more difficult for us to do our jobs and for our staff to do their jobs in caring for residents.
And something to point out, this is just not a problem in rural and small town Pennsylvania. It's also a problem in urban and suburban. This is a universal problem in this state. This isn't, in some respects, even though it has become a little political, basically constituents of virtually, of 18 members of Congress and 253 members of your nodding state legislature are affected by this, correct?
That's our biggest challenge in Medicaid advocacy. Everybody has a picture of the people that Medicaid covers, and certainly there's a stigma out there that people are quote unquote maybe gaming the system. That couldn't be farther from the truth. The vast majority of the people on Medicaid are there because they've run out of money, because they qualify financially, and because they need it to pay for their care. We've been flat funded 4 out of 6 years in the state budget, and we got to find a way to do more for our seniors.
All right, we're going to run to a break. When we come back, I want to talk about what level of funding you need, and then I want to get to lawsuit abuse in the second segment. We'll see you in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Well, Russ McDade joins me. We're chatting about issues affecting senior citizens. Before we move on to the next topic, so what level of funding are you seeking in Pennsylvania?
Yeah, we've asked for a 2.7% increase, which is not to get all jargonish, but it's the rate of medical inflation. So that'll help us keep pace with the medical inflation and help us keep pace with the needs of our staff and our residents.
Okay. Now, virtually every day you see commercials on television that do what? That talk about, you know, do you have a problem here? Do you have a problem there in nursing homes? And here's how you go about reconciling. Translation, lawsuit, right?
That's right.
So you have some big, your organization and others are in favor of what they call lawsuit abuse reform. Do I got that right?
That's right. Reforms to the system. It is a mouthful. And you're right. There are ads out there both on television and in newspapers in particular. In fact, over 150 of them since 2011, Terry, that paint a bleak picture, frankly, of the care that's being provided. Those, hey, if your mom's been in a facility and you think something might have occurred, give us a call. We'll get money for you kind of ads. And it's draining money from the system, and it's taking money away from resident care and away from bedside. It's far from what the trial lawyers would sell it as providing protections for people who've been harmed in some way.
Okay, then the follow-up question is, if this is the situation, then what do you want to do about it? What do you want the legislature and the governor to do? Well,
back in 2002, the legislature and the governor at that time realized for our physicians that they were leaving Pennsylvania in droves for some of the same reasons, and they enacted the MCARE Act. One of the things MCARE did was put a limit on punitive damages. And understand that's the bonus number on top of people being made whole after something's happened. So that bonus number, they put a limit on it at 250%, and we're asking for the same thing, a limit of 250% for nursing facilities and assisted living residences above and beyond what that made whole number or the compensatory number is.
Now, what's the prospects? How's this all going? Legislature, and we're going to talk to Gene and Dave about it, it got its hand full with a whole variety of things. Is this something imminent? Is it something you're going to wait until the budget's done when they come back in the fall?
Oh, no, it's imminent. We've got our sponsor, and it's House Bill 1037, our sponsor, Representative Warnkamp from down the Southeast. We've been working very closely with him, with the House Judiciary Committee, where we're looking forward and working towards committee action and a vote onto the House floor by the end of this month, and then getting it across the finish line in the House and over to the Senate so that we can move this onto the governor's desk and start to help our facilities and the people they care for with some of these real reforms that'll put dollars back at the bedside.
So in the scheme of things for, in the role you play in senior citizens, you've actually cited what you think are two of the huge issues. One is this 2.7%, I think you say, funding increase. Now, the governor only asked overall for a 1.8% increase in the budget. we'll see how that all goes. But there's at least there are ongoing negotiations. I'll talk to Gene and Dave about that in a minute. But the fact of the matter is that these are your concerns, big concerns, and you think you have a chance to get this all straightened out before they take the June 30 or whenever they get done with the budget, that summer recess.
Yeah, Terry, they both deal with resources. So the lawsuit abuse reform, over $100 million a year, our facilities are paying not to provide care, but to fund our litigation climate in Pennsylvania. We've got a member that pays more in litigation expenses than they pay in food for their residents now because of this. And then, of course, on the budget side, it's Medicaid dollars that can help us do our job more effectively.
Yeah. All right, look, this is great. You'll come back and keep us updated. All right, coming up, Gene Barr and Dave Taylor, we're going to talk about a whole bunch of issues that are percolating. One that's done, but a couple that are percolating in the state legislature that are very important to the budget and to the consumers, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Well, Gene Barr, he heads the Pennsylvania Chamber of Business and Industry, and Dave Taylor, he's the president of the Pennsylvania Manufacturers Association. We'll do our little business roundtable. All right, guys, here's the story. The state has at least a $1 billion deficit in this year's budget, shortfall. A $3 billion budget overall. The state legislature and the governor are actually meeting as we speak to deal with the budget. No general tax hike. What does this all mean? I'll start with you, Gene. They've got to come up with money, but they don't want to do a general tax hike. So what are they doing?
Look, it's going to be a challenge. I mean, as you know, it's about $1.5 billion roughly. They're short this year. Some of the money didn't come in, they thought. Some of the programs they didn't implement, they said they were going to do last June, July. It's going to be a challenge. As you note, they've said no PIT, no sales.
Right, yeah.
So they've kind of agreed on the spend number. Now all they got to do is find the money for it, which is very challenging and of concern to people like Dave and I, because we don't believe and we're strongly opposed to business taxes because that impacts Pennsylvania's competitiveness. We're already growing at a rate less than the national average. So to have anything that impacts that's going to be detrimental to Pennsylvania.
Yeah. Well, let's just talk about one of them. Let's take a look at gaming. They're talking about, I mean, every time I read what potentially could be done, it's like we're going to have a slot machine in everybody's house.
Right,
I mean,
right. And I sort of resent the word gaming. I think of that as like being Xbox or PlayStation. We're talking about gambling.
Gambling.
And
good
that
point.
Ultimately, those gambling revenues aren't sustainable because there's not enough disposable income for people to waste on those kinds of games. And so, yeah, you can chase those dollars, but ultimately it's not going to yield what the Commonwealth needs.
Yeah.
I mean, Gene touched on it, and this is the most important thing. Pennsylvania has a growth crisis. Our economy is not growing fast enough. We're not even getting our share of national economic growth, and that's because of policy decisions in Harrisburg. And it's a broad spectrum of things, not all of them related to taxes and spending, although those are important. There are a lot of things the Commonwealth could do to improve growth that wouldn't reduce collections by one nickel. Things like regulatory reform and limits on lawsuit abuse and modernizing workers' comp and unemployment comp.
All right, let's take another thing that they're looking at, an expansion of alcohol. In one case, the legislature, they've been talking, and we're not going to get into bill numbers and all that, we just conceptually talk about, they've talked about with alcohol, allowing folks who retail it to buy alcohol from out of the state wholesalely. Literally, that's the end of the liquor control system, isn't it? Some people.
Well, we're headed down that road anyway. Look,
you think so?
Our organizations support privatization of this. It's what you have to do is look at where the government should be involved and where they don't need to be involved. And in our view, they shouldn't be involved. You shouldn't have an agency that's charged with both enforcement as well as sales. So we're moving to get them out of the retail side. Moving to get them out of wholesale makes sense. We're doing it incrementally. I think people like the changes that have been done. Be able to go into your local supermarket and get your beer and wine. We're moving in a direction that people want. So we're hoping that this continues down that road. Those sales are not a place where state government needs to be. It needs to oversight
Gene,
and enforcement.
You're not talking about the enforcement side of it. That still has to.
They still have to do that. It still needs to be enforced, and they ought to do that. But for all these years, LCB has been both enforcement, advertising, buying, running the stores. That is a conflict, and we need to put them in the proper position, which is enforcement of our state liquor laws.
Well, let me ask you the big question. You get the tough question here. Hit me. What are they going to do anything that the governor will sign when we're talking about both gaming and alcohol? Now, he did sign the pension reform bill. We'll get to that in a minute.
Right.
What's likely to happen here? We're running out of time before they take the big recess.
I mean, ultimately, something's got to give. And if there are ways to bring revenues in to close the budget gap, I would think that it's a fait accompli, because the governor, if he's offered those options and he doesn't sign it, then we go into a prolonged budget crisis, and that's all on him.
Yeah. All right, let's run to a break. When we come back, I want to talk about the budget itself, a little bit about where that's likely to go, and importantly, I never thought in my lifetime that a Democratic governor would sign a pension bill that literally privatizes a good bit of pension, for new employees, which does show you the change in the environment that I think you all have alluded to. All right, we'll do that, and we'll take up a couple of other subjects after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives.
Talking with Dave Taylor and Gene Barr. They represent some pretty big business concerns in this state. Gene, I'm going to come back to you and talk a little bit about the pension bill. The governor signed it. Just go over some of the highlights. We don't have to get into great detail so our viewers get a sense about what does this mean.
It moves Pennsylvania into a more sustainable system. What it does is it takes the old system, which was the old traditional, what's called defined benefit that demographically really wasn't working. And we had a tremendously expensive system, still do, and moves it into what's called a hybrid system. A little bit of defined contribution, the 401k, plus the old defined benefit side. This is, however, real reform. It changes some of the retirement dates. It makes important changes to bring it more in line with what the majority of taxpayers have. This is real reform, and it's taken, to be blunt, far too long. We've got an unfunded liability of over $70 billion as a result of poor decisions made many years ago in certain cases. But this doesn't completely solve it, but it does begin to end the digging of the hole.
But I've heard various numbers, but there was one number that struck me. If the state pays out, has to pay out for all the people who are in the system and retirees in the two systems right now, one for the school employees and one for state employees, $74 billion in debt, up to $74 billion.
Correct.
Now, go ahead.
No, I mean, Pennsylvania is in crisis, and that unfunded liability isn't going away. I mean, the step that was taken was important, and yet it was still really small. This is the paradox of Pennsylvania, where it required great, political effort to achieve what is, in fact, a very narrow policy victory. So, I mean, it was necessary to get it done, but this should have happened years ago. And that Governor Wolf actually had a better bill 2 years ago that he vetoed. So, self-congratulations should be kept to a minimum.
And Gene, you can weigh in. Some folks have said the payoff, meaning the reductions in the debt, blah, 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 the $74 billion, whatever the number actually is, will not take place for many years. Is that true? Or is there?
Well,
are we going to start to see?
It's a question of solvency. And while it's true, yes, that the dollars will not actually go to the retirees, immediately. The fact is, we do immediately need to be solvent in terms of having cash reserves, and so you've seen an escalation of payments from school districts, from the Commonwealth,
and even the Commonwealth. I think it's this year for the first time was paying its full, its annual share.
Last couple of years, I believe we have, but the reality is, within a couple of years, 15% of the general fund budget is going to go to pensions. 15%, and that's a result not of this decision. This decision will at least stop the bleeding, but things that were done much earlier. So this was important, but as Dave said, we need to do more here to bring this in, and we need to make those kinds of changes. The biggest thing of this bill is the shifting of the risk. Right now, the taxpayer is completely on the hook. We owe the money regardless of how the market does or anything else. This creates a risk sharing and shifts much of that risk. In fact, Pew, who has done a lot of work on this, says this is among the, if not the biggest risk shift in the United States that any state has done.
All right, we got the budget supposed to be done by June 30. I must tell you that everything is very quiet on the budget, on what's going on. Now, we know they're meeting, and these are all private discussions. June 30, I don't think anybody wants to be in Harrisburg after the 4th weekend. Maybe you can go the July 4th weekend. Any sense about this?
Well,
I know you both
as
are close to this.
As ever, getting it done right is more important than getting it done on time. Of course, getting it done on time is the much better way to go. I mean, I would expect,
particularly for re-election.
Well, I would expect that by the time that Independence Day comes and goes, that they'll have this figured out.
Who knows at this point? Because when you look at this, you would think that given that next year is an election year, this would be the year when tough decisions would be made. And I see a lot of shoving, well, let's maybe do that next year. And I don't know that they're going to do that next year. Pennsylvania has severe problems here as a result of decisions made over the years that have gotten us into this position. As Dave said, the non-growth decisions, the structural deficit issues, and those have got to be looked at, and we've got to develop a climate that's going to grow Pennsylvania, grow jobs, grow the economy. That, from our perspective, long-term is how we're going to have to do this. And we need more in terms of some of those policies that need to be done. Are we going to be done by the 4th? Who knows? Yeah, we're just about out of time, but I think you're right. It's important to get it done, to get a consensus. It would be nice if we got a consensus between Democrats and Republicans, and it was more bipartisan. All right, thanks for coming in, guys. Appreciate the update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.